Okay, switching gears now to the topic of fertility oversight. I recently chatted with fertility specialist Dr. Mark Trolice about assisted reproductive technology and its oversight. Here's more now for today's In-Depth. All right, Dr. Trolice, when it comes to assisted reproductive technology, what agencies oversee it?
Well, right now we have the American Society for Reproductive Medicine and the Society of Assisted Reproductive Technology that for years has been providing guidelines, standards of good practice for the areas of assisted reproductive technology, which is typically in vitro fertilization. We also have the College of American Pathologists, called CAP, that oversees the laboratories for compliance and standards of practice. And then we are one of the only medical specialties that have to report our outcomes to the CDC. It's by law. Okay. So we have a lot of guidelines in place for our field, probably the most of any field of medicine.
When it comes to fertility clinics, specifically, what are they doing to protect patients?
Well, that's the major issue. And I would say that so many guidelines are in place to do that. These circumstances have come about as a result of human error. Yeah. That can unfortunately always happen. Now, some of the issues that have come about have been much more questionable in terms of using sperm of a physician without the patient's knowledge, or using sperm from an employee at a hospital that apparently has just come about. So those are circumstances that obviously are not human error. But checks and balances are in place in all laboratories to do everything possible to ensure that the patient's egg, sperm, embryos are going to the right patient.
Now, what about legislation? Are there any states that are introducing anything to protect?
Ohio is doing something right now. I don't believe it's gone through. But what we need, obviously, are better tracking of patients. What we're doing in our program is that we just brought on a biometrics device that is allowing the patients to have essentially fingerprinting of their embryos. That from the time the patient enters our program to the time that they go through entirely the entire process, we verify every step along the way to assure that it's that patient's eggs, sperm, and embryos. They're also doing some research on biological labeling of the embryos to ensure that that's the patient. Another thing that we haven't talked about, Eric, though, is that there was some catastrophic event last year in 2 different programs almost simultaneously where liquid nitrogen leakage destroyed thousands of eggs and embryos, because that's where the embryos are stored and the eggs are stored in the freezing storage tanks, and the alarm system apparently didn't go off, or it wasn't on. So, to me, yes, you could have all the guidelines in place and you could have all the standards of practice. Human error is something that is very, very difficult to overcome.
Now, are the overseeing agencies then doing anything to address these, incidents?
Well, obviously, CAP inspections are visiting the actual centers to ensure that documentation is in place and all compliance issues and quality control are being performed. What I think also is what I'm recommending is that limiting the numbers of patients or numbers of procedures that an individual person in the laboratory could do, okay? Limiting the number of hours at one time that a person in the laboratory can do. Courses in place for assuring safety and identification. Things in a very, very proactive manner. Even not advertising, but noting on websites which programs are in compliance with what is going on. Patients entrust us with their eggs and sperm, the most precious part of their lives. And we have to ensure that trust. And these kind of things, although rare, thank God, should not happen. And human error is a part of medicine, unfortunately. We've seen wrong side surgery, God forbid, and those things have happened. But we must place upon ourselves that these things cannot happen, and to do absolutely everything in a proactive manner in the laboratory to track patients and give them that guidance and reassurance.
Our in vitro fertilization local expert, Dr. Mark Trolice with the IVF Center. Good to see you as always. Thanks for coming in.
Thank you for having me,
Thanks
Eric.
for spending some time.